Welcome, everyone, to Understanding the Human Condition. I'm your host, Dr. James Flowers, joined by my lovely co-host, Robin French.
Hi, Dr. Flowers.
How are you?
I'm very good. How are you?
I'm super excited today. My good friend and colleague, Dr. Paul Fortes, is here.
Yay.
Good to be here. Thank you.
You know,
Welcome
you
back.
are so busy. Thank you for taking time today to come over.
My
and-
pleasure. We did this a while back. And
We
I
did.
think we're overdue.
I know. I think we had like millions of fans requesting you
That's
to come
great.
back.
So, for the audience, today we're discussing a topic everyone can relate to. Will cosmetic surgery make you a happier person? But we're going to do this while Dr. Fortes applies Botox to Dr. Flowers.
We're going to make him a happier person
You
today.
know what? Let's see if it makes me any happier. I've never had Botox.
On air or on air.
Yes, I have. Not on air. That's right. And I think it's such an important topic. You and I have talked about this for a couple of years now, does cosmetic surgery and the things that you do in the spa and the things that you offer in your practice, and which we'll talk about, does it help not only physically, but does it help emotionally and psychologically? So we'll talk about it. But if you want to go ahead, we'll do
let's
this.
do it.
Hold on, everybody.
So I have a bunch of questions for you also
Sure. Yeah, you
about
can
this
talk while we're doing
while
this.
you're
I
doing
can-
this procedure.
I can chew gum and pat my head.
So I think we touched on this a little bit earlier too. As far as Botox, it's mostly for you do it for minimizing lines, right?
That's right.
And there's one other thing that you might use it for.
Well, you know, it's been around for a long, long time. Probably we're talking that it's been around probably for 30 years or more.
Yeah.
And it started being used really to correct imbalances in the muscles around the eye.
Right.
So the ophthalmologist used it for that, and curiously, they noticed that it helped with wrinkles, and so
Yeah.
it started being used by plastic surgeons and dermatologists, but the people who are in the beauty business, like
Yeah.
I am in the beauty business,
Yes,
Yes,
you
you
are.
are.
and we never looked back, and we were saying that back when I started over 20 years ago, it wasn't a household name. Now it's become everybody knows about Botox,
Yeah.
whether they do it or not.
Right.
Now
and they're
people seem
familiar.
to have nurse practitioners come to Botox parties.
Right.
Yeah. Well, we were
Exactly.
talking about that too because they have these Botox parties, but some of these people aren't really qualified. I mean, you really need to know who's giving you the Botox because there are some downsides to someone who
Absolutely.
hasn't been trained properly.
Well, Botox comes from a manufacturer that has very high standards and high quality control over their product, and they only make it available to people that are qualified to deliver it. So people who are not, either they get it through unconventional ways, or maybe they get bootleg product. And it works great, and it has a high satisfaction level, and low risk. And it's been around for many, many years, so the safety profile is great. But it's for the product that we know that works, not for stuff that we don't know how it works
right.
Yeah.
or if it's safe.
Yeah.
And so, for a product that has not been subjected to the same level of scientific scrutiny, it can be dangerous to use that kind of a product. And so for people who aren't sort of trained or approved to get it, they're going somewhere else
Yeah.
to get something that's not really true Botox. And so, I mean, you have to know who's doing it and what their training is, and
Right.
so that you're getting good quality products and a good result.
Right. And there are other products besides Botox similar, right? Correct?
Yeah, there are several that have come and gone, and probably the only other one that's had lasting life has been another product called Dysport,
Yeah, I
which
was
is
gonna
almost
ask about
as popular as Botox.
Yeah.
Botox, because it was the first, of its kind, will always be recognized for that, and probably will be recognized, have greater household recognition
Right.
than Dysport. But I use them both, and they're both
Do you?
great quality products. Yeah.
Okay.
Well, we're using Botox for you today.
Okay, perfect.
Awesome.
All
So
right.
should we do it?
Let's give
Yeah,
it a
let's
try.
roll.
All right.
Or not give it a try. Let's do it. Don't try.
Don't try, do.
That's right. Absolutely.
So, and it works. There are several areas on the face where we do it, and And even, we were talking about other things where Botox can be used.
Yeah.
That's not just about reduction of wrinkles.
Right.
But, we're going to treat wrinkles today. And there are 3 sets of wrinkles that probably are the most popular ones to treat. Those are the horizontal lines in the forehead, and
Yeah.
then the vertical, which you want treated.
Mm-hmm.
And then the vertical lines between the brows. And the third set are the crow's feet.
Yeah.
And so we're going to do 2 of the 3, right?
Sure, we are. Yep.
Yeah.
And maybe we can do the third later.
That's
Yeah.
right. Absolutely.
But we
Yeah.
were talking earlier about things like TMJ,
Yeah.
where the muscles in the jaw and in the temples can create pain in
Yes.
the TMJ. And so Botox can be used to correct that.
We have a patient that
So,
does that.
Sure.
Right?
And I'm a clencher at night. And would Botox here help with that?
Yes,
Yeah.
it helps with that.
Yeah.
It also helps when those muscles are so strong that they increase the width of your jaw. And so over time, you can inject them to create a little bit of atrophy in the muscle so that they're not so strong and bulky.
Yeah.
And it slims down the jaw. And that works great too. But it works for people who are sweaters,
Yes.
Yeah.
you know,
Heavy
armpit sweaters, palm sweaters.
Yeah.
It's good for, a little bit of hyperactive bladder also. And the other one is migraine headaches sufferers. Now, I don't
Yeah,
treat migraine
I've heard
headaches
that.
specifically, but the patients that I treat for wrinkles who happen to be migraine headache sufferers tell me that their headaches are better. So
Wow.
that's a sort of a bonus
Yeah.
Sure.
Right.
Yeah.
from the Botox treatment.
Yeah, we've had several patients with migraine headaches that have, when they go to anesthesiologists, pain docs, that will have that Botox injection or even Botox in back here in the shoulder area.
Right.
Yeah.
Yeah.
Well, it paralyzes muscles, and the muscles that we paralyze for wrinkles have their set anatomy. So plastic surgeons know the anatomy
Yeah.
very, very well. They're familiar with it, and so we mark the areas of the muscles where we're going to inject, and so we know we can control the way that the wrinkles are corrected.
That's
Yeah.
what that
By
pen
the,
right there
by
is.
the
I have a
that's,
feeling.
yeah, we got a pen to mark them.
I can't wait.
So let's do it.
All right, let's
tell me
do
what
it.
to do.
All right,
Yeah. Walk
so-
us through it verbally.
Well, the first question that I have with the patient is, what wrinkles bother you? And then they tell me if any of the 3 or all 3, and we can treat all 3. There's a certain amount of the product that we inject so that we know it's going to be effective. And for Botox, I usually inject 20 units in each of the areas.
Okay.
So 20 units in those strong muscles. Look that way so they can see.
Oh, yeah.
Yeah. You see how these muscles wrinkle and they're
Yeah.
called the 11 lines because there are these 2 vertical lines there in between the brows. And there are very strong muscles in this zone that we'll treat by injecting them.
Sure.
Okay.
And in the forehead, there's a muscle, and then show me that expression of surprise. Yeah, these lines that are there from the activity of the muscle in the forehead, and then the crow's foot. When people smile big or squint,
Yeah.
they get these lines
I
that
have
come from
big
the corner,
crow's feet. Yeah.
from the corner of the eye, and so we treat that area too. So we're going to treat here and here.
Okay.
Okay.
Wonderful.
We usually wipe down the area with alcohol.
Awesome.
And then we'll
Yeah.
kind of dry it off.
Okay.
And then I'll have the patient.
You want me to kind of turn this way just a
Sure.
little bit?
Yeah.
No, yeah. I want you to hold that expression, the one that you just made. Yeah. So we're going to, and
Okay.
he's got very, very strong muscles. So we're going to go way out here.
You see that look? You never want him to walk into your office with that look.
And so these are the
Run, don't
points.
walk.
These are the points that we're going to inject the muscles, and then relax. That's where we're going to inject the Botox.
Okay.
And then show me surprise look again. Okay.
Okay.
Actually, those muscles aren't as strong.
Ah.
Okay. He's pretty.
It's because he's never
smooth.
surprised. Nothing surprises him.
Whatever.
In this business, nothing
Nothing,
surprises
Yeah, right.
us.
nothing surprises him anymore.
Yeah.
So, Botox actually comes in a little bottle, and if you look at the bottle, it looks like it's an empty bottle, but it's the product is this white crystalline powder that's on the surface of the inside, and so We inject saline and we mix it up. It has to be used, pretty quickly. It doesn't store particularly well. So it looks like this.
Oh, cool.
We draw it up in a syringe with a very skinny needle on the end. And that's what we're going to do to
This is where I
inject it.
close my eyes and let him do his work.
Exactly.
So
Now, and how long is this going to last?
typically it lasts for about 3 months.
Okay.
And if people get into the habit of doing it regularly, it may last a little bit longer.
Okay.
Maybe 3.5, 4 months.
Okay.
It's unlikely that it's going to last a full year. And people comment sometimes that they notice that it lasts for 6 months, 12 months. I think what's going on there isn't that the product is continuing to have long-lasting effects. I think people are retrained how they use their muscles,
Yeah.
and so they're not wrinkling
That's
as
a good
much
point.
because
Yeah.
they've been 3 months without without using those muscles,
Yep.
and so they continue not to use them. And
Yeah.
maybe they're saying that they don't have wrinkles for a longer period of time. But usually 3 months is how long it lasts.
Okay.
Okay, so
All right.
we're gonna go. Just small quantities.
I think it's also important for the listeners and the viewers to see that it's really not as painful as some people. Some people don't get it because they think it's horribly painful. It's not that bad.
No, and
It's not.
I've had it done before, and it feels a little bit like a pressure
Yeah.
more than anything else, and you can hear
That's what it feels like, is a little crunch. You hear a tiny little crunch,
Yeah.
but your hands are so steady, right? So that helps.
Yeah. Well, that's good.
So, but for the ones that prefer, we can put even a little numbing cream that helps
Yeah.
as well.
Yeah.
Okay, we didn't bring the numbing cream today, so
I
he's gonna have
had
to
a-
tough it
I
out.
Where there's a
feel it.
little can of freeze spray and they squirt a little, they spray it
The
on,
spray?
stick me, spray it on, stick me. Yeah.
That works too.
Yeah.
Mm-hmm.
Yeah.
Okay, you did great.
That's great.
Yeah. You handled that like a champ.
Yeah.
Wow.
I'm gonna do the other
Okay.
Yeah.
muscle group.
Sure.
So we wanted to talk more about how plastic surgery makes folks happy. I mean, it just makes them a happier person. And I was sharing with you a story. One of my girlfriends said that she had her breast implants put in, and she said, Robin, that was better than 10 to 15 years of therapy. It just, I'm sure you've heard that before.
Well, I live it every day because I see those patients.
Yeah.
And I see patients for a long time after they've had surgery. It's not just for a few weeks, but I've had patients of mine that have been ongoing patients for years.
Mm-hmm.
And there's a high level of satisfaction early on,
Right.
continues. So
Yeah.
it doesn't seem to go away.
Right.
Yeah.
And so...
Tell me if I need to turn.
No, let
Okay.
me have you turn just a little bit that way. So no, I think there's a high degree of correlation between changing someone's self-image
Yeah.
and their self-esteem
Yeah.
and how that influences the inside, or how the outside influences the inside.
Right.
I think it's very powerful, and it's almost has a compound effect, because the way that you can change a person then spreads to everything in their life,
Oh,
their
gosh,
interactions
yeah.
with other people, their spouses, their children, their bosses. They
Yeah.
make better employees. They're more productive. They so I think it's not only long lasting, but it comes back in so many different ways.
Mm-hmm.
I remember my mother had surgery on her nose, and it just made a huge difference to her. Her nose had bothered her, and she was very self-conscious. But afterwards, it was really...
How'd you do?
Good. That's great.
Awesome.
Is that it?
Is that it?
That is it.
Wow. Thank
Oh my
you so much.
goodness.
You're very welcome.
Yeah,
Now-
all you hear is just this little tiny sound of like a small crunching sound. And what is that sound from?
There
that
is
the-
a
What is-
fascia or the muscle covering.
Crunch?
Yeah, people sense it, and
Yep.
it's basically the tiny needle going through
Mm-hmm.
that muscle membrane, and that muscle membrane is kind of hard,
Huh.
and so you feel that crunchy sound.
And for all those people that know me, they know that even for me getting a flu shot is
Yeah.
difficult. I hate pain. and I couldn't
did
feel
great.
this.
No,
It was-
you didn't
I mean,
even- yeah.
I barely. Thank you so
You didn't
much. That's
flinch.
amazing.
You're very
Thank you.
welcome.
And I didn't want to say this with a needle in my in my forehead, but what I want to say about the 10 to 15 years worth of therapy is that this is an amazing adjunct to therapy, right?
Yeah.
It is when you have depression or you have anxiety or you're going through grief or trauma. I work with a lot with chronic pain patients who find it difficult to get out of bed and function during the day,
Yeah.
right?
Yeah.
And I always tell them, look, just by getting up and putting on your makeup and doing your hair and getting dressed, you feel better. When you look in the mirror and you're 56 years old and you have a bunch of wrinkles
Yeah.
versus when Dr. Fortes puts a little Botox in my forehead, I feel like $1,000,000.
Right?
Yeah.
Yeah.
Absolutely. It's
You
just
know,
I get it.
When I was in medical school, we kind of had this notion that the brain, after it develops early on, kind of stayed fixed, and the only thing you can expect is to lose function,
Right.
rather than gain function.
yeah.
And there have been studies showing that that's not necessarily true. That the brain is a very plastic organ, and probably, as you were saying, if you think positive thoughts or engage in positive activities, that can affect
Yep.
your chemistry and the structure, even the structure of your brain, toward
Right.
ongoing experiences that are
Yep.
similar to the ones that you
You
kind of
bet.
force yourself
Yep.
to have.
Yeah. Absolutely.
Stay away from alcohol because that's a depressant.
Right.
Right?
Sure. You
Yeah.
bet. Yeah. I'll say in talking about the mental health aspect and the feeling of what plastic surgery and cosmetic surgery does to the human body and the human mind, and this is understanding the human condition. I'm happy to say in front of Dr. Fortes or in front of all of you listening and watching on video, Dr. Fortes actually did a male body contour on me about a year and almost 2 years ago. Gosh, almost 2 years ago. And the psychological and emotional feeling, I'm a former marathon runner, right? I think I eat right. I think I exercise appropriately. But there are certain little things on your body in your mid-50s that are just there and are not going to go away no matter how much you work or how well you eat. And Dr. Fortes was able to do that. And emotionally, you feel better. I was at the pool at the Houstonian all weekend, and I was like, I look pretty darn good.
So what's the downtime with that?
Right.
And what's the downtime when you had
Well-
that done? The procedure that you had?
Oh, well, he said I was a A-plus patient.
He was.
I bet.
He had
He's
almost
a
no.
toughie.
Yeah.
He is a tough. He
Yeah.
almost had no pain after surgery,
Yeah,
and his
it was
recovery was
wild.
pretty quick.
It was really quick.
But I would say, a few weeks, certainly. It
Yeah.
depends on the extent of the surgery. If you have more surgery, then the length of the recovery is longer. But usually after about a month and a half, people are ready to get back to most normal life activities, going back to work for sure. And I've had patients go back as early as, a week and a half.
Yeah.
My own patients in the office have had plastic surgery with me, and I see them coming back to do their job pretty quickly.
Sure.
And so how do you prevent it from coming back or doing that again? It's just, it won't?
Well,
Do you
I
just-
don't.
do you have
I
to
don't think
diet
you.
and
I don't think
exercise?
you do. I think you still have to eat right and exercise. But from my from my brain perspective, look, I want it to last forever,
Right,
But
right.
it's not going to last forever.
Yeah.
So in 10 years or so, he better still be practicing.
Yeah.
Well, it's interesting, and
Yeah.
I told you sort of what my personal experience has been taking care of patients
Right.
for a long, long time. But you don't have to listen to my opinion or take what I
Yeah.
have to say at face value. There have been
Right.
actually studies on patients who have had plastic surgery and comparing them to the same kind of similar cohort that considered plastic surgery but ended up not having plastic surgery.
Yeah.
And long term, we're talking, a year or longer, that the ones that had plastic surgery still felt better, had higher levels of self-esteem, higher enjoyments of
Sure.
life, less anxiety.
Yeah.
So there are
Yeah.
long-lasting benefits to having plastic surgery. It's not just superficial.
Right.
I mean, it affects your core.
Sure. All of those things I would say I experience
Yeah.
and experienced. And again, it's been 2 years. I feel fantastic.
Yeah.
We all have our own, health issues in life. And when I say that, our own mental and emotional health. And as you know, in my life, I've had problems with early childhood trauma and, all kinds of things.
Right.
And I work with patients every day that are very depressed. And sometimes that can affect the way you feel. Right.
Right.
And for me, this was one of those things that just helps me feel better.
Yeah.
And you always want to get it from the best.
For sure.
So, yeah, absolutely.
You have an excellent reputation.
Thank you very much.
Yeah.
You do.
I would
yeah.
say the other thing he has is probably the most stunning office you've ever seen in your life.
Really? I'm going to have to get up
Yeah,
there.
beautiful office.
Well, I love coming into work every single day, and I feel blessed and fortunate to do what I do, where I do it, and with whom I do it.
Well, yeah, you
Yes.
have an
And
office full of beautiful women, too.
Yeah,
He does.
they're not just beautiful. I mean,
They're
on the outside,
talented,
they're beautiful
yeah,
on the
yeah.
They
inside.
are.
Yeah, they
let me
really
tell
are.
They're
you.
the friendliest,
they really are.
friendliest group of people.
Yeah.
You know, Robin was asking a question earlier today to me, and she said, "Men versus women in plastic surgery and cosmetic. What are you seeing in 2021?"
I think the numbers continue to break down similar to historic numbers, and that women have always felt comfortable having plastic surgery and talking to their plastic surgeon. And so they probably outnumber the men still,
Sure.
probably 90%
Is that right?
to 10%.
Yeah.
But men are slowly creeping,
Yeah.
out of the primordial ooze and coming in
Yeah.
because they feel that it's something that there's no longer a stigma attached to having plastic surgery.
Right.
Right.
People have it and they're open about it.
Sure. Yeah.
It wasn't that way, in the old days, but now I think people are accepting and are benefiting from having plastic surgery
Right.
Sure.
for all those reasons that we talked about earlier.
Yeah.
Yeah. What else do you do? Let's talk just for a minute about the practice. What is your core clinical love, right, in surgery? And then what services do you guys offer? And then I want to talk about the spa and what the spa offers.
Well, the people in my office, the ones that know me best, call me a jack of all trades because
There
I
you
like
go.
doing everything.
Yeah.
Good.
And I enjoy doing everything, because variety is the spice of life,
Sure.
right?
Yeah.
Yeah.
And so I do all kinds of breast work, men and women, by the way. It's not just the gals that come in, but guys do too. And they have body contouring surgeries, breast surgeries, facial rejuvenation surgery, things like facelift and eyelid lifts, chemical peels, which is nowadays something that's more spa treatment than it is a surgical treatment. But yeah, I do all those things. And for men, liposuction and facial rejuvenation, male breast development, gynecomastia, which is very common. Men sort of historically have never talked about it, but now they're talking more about it these days. That's another concern that they come in with.
Yeah.
Sure. Dad bod.
Dad bod.
Absolutely. Which is kind of what I had. Dad bod.
Did you?
Yeah. Without being a dad.
Hey, we had-
Dad to 3 dogs.
I do mommy makeovers, and now I'm going to do a daddy do-over.
There you go. Daddy
Oh,
do-over.
I love it.
Absolutely.
Great idea.
Yeah. And then over in the spa.
There are lots of non-surgical things that are done in the spa to, fillers and Botox, which we
Yeah.
did today, is
Sure.
very, very, very common. And then, of course, resurfacing treatments of the skin and treatments of the body as well.
Sure.
There have been a development in the last several years of new devices that help improve the appearance of the body, reducing fat in a non-surgical way, tightening skin in a non-surgical way. So all those things are spa treatments.
Right. Absolutely.
And it can be done under local anesthesia even.
Are you doing those like the warm sculpting and the cool sculpting and all of that?
Yeah.
You are?
Probably the big procedure that is sort of the darling of all plastic surgery offices these days, or most of them, is treatment with radiofrequency. And radiofrequency heats up the tissues and can help tighten the skin, reduce fat, smooth the skin out,
Yeah.
eliminate a little bit of the jowls, I had the treatment, by the way, so yeah. And you can also reduce the fat, the sort of the turkey neck in a non-surgical way. So yeah, lots
Very
of treatments
cool.
in the spa that are.
A really good friend of mine, a psychiatrist, had something with threading. Tell us about that?
Yeah.
Threads are a device that's placed underneath the skin under local anesthesia that literally lifts the skin. So if you have sagging jowls or sagging necks, they can be inserted underneath the skin. And sometimes over time, the modern ones dissolve so that they are no longer there long term. But once you heal with a tighter neck, it can last you for many, many months. And the best thing about that is that it's an easy procedure to do under local anesthesia, and the downtime is minimal.
Really?
Yeah.
It sounds painful, but
Well, I mean, the way that it's done with local anesthesia, it's kind of like going to the dentist. Once you get past the blocks,
yeah.
you don't really feel anything.
Right.
It feels completely numb.
So that probably postpones any facelift that you need to have, right?
It
for a little
can,
while? Yeah.
especially for people who are seeing early changes in aging of their face. They don't have
Sure.
to go to under the knife,
Yeah.
to get an improvement. They can do, they can start off with easier things to do and to recover from.
Yeah. Yeah.
Sure. I think probably in your former life, your former career before you joined our practice, working with men and women all over the world who were looking for a new relationship, right?
Right.
Is this something that you saw or
the
that
need
you would
for plastic
recommend?
surgery.
Yeah.
I see it all the
Oh,
time.
I was going to say,
exactly.
yeah,
Yeah.
building new relationships and getting that confidence,
They
right?
want to spiffy themselves up before they
Yeah.
get out there. Sure,
Yeah,
sure.
absolutely.
If you can afford it, if you've got the disposable cash, why wouldn't you?
Yeah.
Right?
Well, as we were saying before, it's not the results are secondary in nature. It's to feel better about yourself so that you can transmit that level of confidence to the people that you're out there
Yeah,
Yeah.
who you're trying to get their attention.
absolutely.
Well, and on the subject of disposable cash, is there anything that you do that's covered by insurance? For instance, some like breast reductions and things like that?
The procedures sometimes that sort of are in a gray area
Okay.
of cosmetic plastic surgery are those two things. Breast reductions, when the breasts are so large that they interfere with function,
Right.
they often are a procedure that's covered by insurance.
Yeah.
And
Makes sense.
loose sagging skin. In these days, it's very common for people to have weight loss surgeries and develop significant loose sagging skin. And I don't know exactly how all insurance companies work, but certainly a lot of those procedures that are about restoring function can be
Yeah.
done through insurance.
I did not know that. So I used to I've probably done 5,000 pre-surgical behavioral evaluations preparing people to go into
Yeah.
gastric bypass surgery. And one of the big issues is a year, 2 years afterwards is that sagging skin that then they would go see a plastic surgeon. And I always experienced it as more of a cash pay option, but that's interesting to know that insurance may or may not cover that.
Right.
So, but you're primarily a private pay practice.
Yeah. Years ago, when I first started, I did not just cosmetic surgery, but I did all of general plastic surgery, from hand fractures to carpal tunnel surgery to
Right.
injuries of the face. And now my practice over the last several years has evolved more toward
Sure.
aesthetic surgery. So I guess back in the day, most of those things were through insurance.
Sure.
But as my practice has evolved, I'm seeing less of insurance, kind of a patient base, than a cash base.
Yeah.
And you're seeing international patients that come from really.
Yeah, they find me from everywhere. I don't know. They go on the internet, they find me, and the next thing you know, they're on a plane from Africa.
I love it. Yeah.
They find you on social media.
Everywhere.
You hit, what was it, 5,000?
Yeah,
on Twitter?
Stacy's in the corner. She's my social media
Hey,
queen.
Stacey.
5,000 on
Yeah.
Twitter, was it?
On Instagram.
Instagram.
That's amazing.
Woo!
That is
Congratulations.
fantastic.
Thank
Yeah,
you.
that's
Yeah, she's
great.
made it possible.
Yeah, there you
that's
go.
awesome.
Come on over and help Jay Flowers Health Institute.
We
The
need
social
some
media
help with
queen.
that.
Yeah,
We do.
absolutely. And you have how many physicians now in your practice?
Now we have 8.
8.
We've
Wow.
grown.
Yeah, you have.
We
Grown.
have 8 doctors in the practice and 2 fellows, meaning that they're fully trained plastic surgeons with the interest in developing a practice in aesthetic plastic surgery. So they're doing an extra year with us
Sure.
to learn how
That's
how
amazing.
what we how
Right.
how we do plastic
Yeah.
surgery.
How do you feel about teaching people how to?
I
do
love it.
Yeah, good.
I love it.
that. I do too. It's
That's
always
really
nice to have.
cool to pay it forward.
Yeah.
Yeah,
That's
it
really
absolutely.
is, Yeah.
I mean, what's the point of keeping it with you
Right.
if you can't share it?
Yeah. Yeah. I think that's fantastic.
That makes sense.
Being a training institute in a way. Yeah.
We've surpassed
know.
our 2-minute.
I know. We have.
Our
I know.
2-minute warning.
Tell us how people reach Dr. Paul Fortes.
Well, the easiest way is to, call my office.
Yep.
Stacey, you're going to have to come over here and help me with this.
Yeah. What's the phone number, Stacey?
The number is 713-799-9999.
That's easy.
Awesome.
Yeah,
That's right.
It's a 713 followed by 7, and then the rest are nines.
Nines, there you go.
Easy to remember.
And what's
It
the
is.
website?
FortesMD.com.
Yeah,
FortesMD.com.
and that's FORTES,
Yeah.
MD.com.
And obviously, I'm on social media, so look me up on social media and become the 5,001 follower.
Yes, there you go.
That's it.
I invite
Exactly.
you. We
Yeah.
have some cool stuff on there.
Aw.
Yeah, you bet.
all
Well,
the time.
wherever we are, whether I'm sitting at the Houstonian or we're at a club somewhere else or we're anywhere, we always see I'll open up a magazine and your face is typically
You
in
are.
there. You
Yep.
and Cindy or you and your staff, all of you guys, and you do such amazing work. And I think that you help a lot of people. And we really, truly wanted to do this today because there is a definite connection between emotional health and physical health
Yeah.
and looking and feeling your best. And I think that what you offer helps people feel their best.
That's
I
right.
wholeheartedly believe that.
Yeah,
Yep.
absolutely. So anybody that wants to feel better and look better in addition to your therapy that you certainly have the option of doing, and I think is a primary help in emotional and mental health, certainly look up Dr. Fortes. He's amazing. His practice is amazing. And thank you guys for all listening and watching today.
And you're a living, breathing, walking billboard for him.
Well,
I mean,
I don't know about that,
seriously.
He
No,
is.
He really is. Yeah, he is.
Find me at the
Now-
Houstonian on Saturdays.
Yeah, by the pool.
Yeah.
Exactly. Check it out for yourself.
Yeah, there you go.
Now, if someone wants to reach J. Flowers Health Institute, how do they reach you?
I think the easiest way is jflowershealth.com.
Great.
Yeah, you bet.
And so, just to remind everybody that we're on several different platforms. We're on YouTube, Apple Podcasts, SoundCloud, Spotify, Stitcher, and iHeartRadio. Please share this episode on social media or with someone you think it could help. And we need to remind you
Yeah.
that a clear diagnosis is the key to the most effective treatment possible.
Absolutely. Dr. Fortes, thanks so much.
Thank
Good to
you.
see you.
Thank you
Great
for
to
having
see
me.
you.
Yeah.
Thanks. Bye, everyone.
Please join us every week for a new episode of Understanding the Human Condition with Dr. James Flowers. Dr. Flowers and his most admired mentors, respected colleagues, and VIP guests will share valuable insight into underlying health causes, conditions, and issues. These in-depth yet approachable episodes are a great resource for both private individuals and industry professionals. Our esteemed host, Dr. James Flowers, is one of the most recognized and respected names in the field of chronic pain, mental health, and substance use disorders, both nationally and internationally. Dr. Flowers is the founder of J. Flowers Health Institute, located in Houston, Texas. For more information about J. Flowers Health Institute and its concierge services, go to jflowershealth.com or dial 713-783-6655. And be sure to mention this podcast.